Hi, my name is TJ, DPT student with Tufts. I'm here with my wonderful fiance today, and we're going to do some knee evaluation. We're going to start off with a patellofemoral assessment, specifically the patella apprehension test, just to kind of see the functionality of the joint and the movement of the patella. Georgia, is it okay if we do some tests today underneath?
Yes.
Okay, so I'll have Georgia lay down on the table, please. And then for the camera angle, I'm going to do this knee right here. So I'm going to prop it up. I want it to be at about 30 degrees of flexion. So okay, 30 degrees of flexion. For this test, you'll be starting on the medial border of the patella, so on the inside of it. What we're looking for this test specifically is if it reproduces symptoms, whether that's pain for Georgia or whether even Georgia just experiences apprehension in me doing the glide specifically, and that can kind of give us an idea if we have problems with the patellofemoral joint. So place my hands on each superior and inferior parts of the patella, thumbs on the medial border, and then from here, I'm going to glide that patella over, looking at the patient's reactions. Georgia does not like this. She's pretty apprehensive, so I would say this is a positive test for the most part. Okay, go ahead and rest, George. And then I'll have you sit up for me, please. So this camera angle is going to be a little bit funky, but we're going to do a patellofemoral traction. So I'm going to be in a chair. If I had an adjustable table, what I would do is essentially put the patient's leg between my legs, and I would be facing the patient in normal regards, but just for camera angle, I'm off to the side. But then I would, as the patient's leg is in, or foot, ankle areas in between my legs, I would lift the table up to create traction to the patellofemoral joint. But we'll get nice and close, create that traction, and then from here, we're doing anterior, posterior slides actually. Before we start, let's make sure we get this underneath the knee so that we have some good spacing. Here, I glide down, and then in this position, on each side of the tibia, I can create anterior and posterior glides just to see how it moves, still maintaining that downward traction. Thank you, Georgia.